Hi, Michelle.
Hello, how are you?
Doing okay. Now, and we can start the meeting, I guess?
Yes, we can start now.
Okay, I'll call the meeting to order. Certification of open meeting law requirements have been met,
They have been met.
so we need an adoption of the agenda.
I would ask that items,
Yes, I can, if you
Okay.
want me. We're gonna move the financial report and personnel report up to right before the closed session.
yes.
And if there is not any questions, I'd look for a motion to approve.
19 and 20 will go ahead of 16. That way when we're,
Approve.
Michelle?
Michelle makes a motion.
Okay, second?
I'll second Karen.
Okay, Karen, second. All those in favor signify by saying aye. Opposed, same sign. Carried.
Oh my God.
Okay, we have the minutes of the August 23rd and September.
You don't have
3rd.
August 23rd. I was going to do those.
Okay.
All of a sudden, I'm like, I was going to do those this weekend and I completely forgot.
Okay, we got the 13th though.
Yes.
Yeah.
I'll get you those the next time.
Yeah,
I apologize.
okay.
They're not even that long. I just didn't sit down and type them, so.
Okay, the minutes of the September 13th meeting. If there's any questions? I didn't see any myself.
I make a motion to approve.
Motion was Michelle.
Second.
Michelle made the motion, Dora second. Okay. All those in favor signify by saying aye.
Aye.
Opposed, same sign. Carried. Okay, an update from Nicole Millerin and Stacy Shapiro.
Yes, let me hand, I emailed those out to you, so you should have those. And Diane is now here, so this is awesome. Here you go, Kurt. One to Dora and one to Diane.
Here, thank you.
Eric will be my good running person. Thank you.
Issy, if you want to go first, you can.
We just handed out your report, Nicole, so thank you. Oh, let's see.
Sounds good. I will start then. Good afternoon, everyone. Good to be here again. And yeah, I'm hearing myself talk back to me, so I thought it was somebody else. It's me. And I just, Deb had asked that we both share a little bit about what we've been doing and what we're doing moving forward. And I've really been enjoying meeting with Deb on a regular basis, on a biweekly basis, if not more, and just covering different leadership strategies and to move positively forward. And I think most of you know that we had a training last week, a kickoff to a super culture, a super work culture, and that was with the human services staff. And, I utilized the survey results that had gone out thanks to Nicole and conversations with Deb and Erica and Nicole and all the information provided along the way, and utilized that for our 3-hour training. And that was regarding what work culture is, looking at core values of Trempealeau County Human Services and personal values, how everyone's part of a solution, staying positive, and just change in itself, how we can change ourselves and how we can let others do the same thing right around us. So that was our first training of 3. The other 2 are November 18th and January 20th, also from 9 to noon. I invite you all to attend those as well. And I know Deb and I will continue to meet, and I'll meet with Erica as well. And I'll just be continuing to observe some various meetings along the way too. So are there any questions for me?
Does not appear to be. Thank you, Stacy.
Okay, you're very welcome.
Yep, thank you.
Could you just review those dates and times again? I'm sorry.
You bet. It's November 18th and from 9 to noon. I don't have the day of the week here. I don't know if Deb, do you know if it's a Tuesday or Thursday? I know
They're
it's one of
Thursdays, yep.
Thursday, November 18th, 9 to noon, and then January 20th. Is that also a Thursday or is that a Tuesday?
That's a Thursday as well.
Okay, so 2 Thursdays, and they're both 9 to noon.
Yep. They're both the third Thursday of the month, so that we scheduled those during regularly scheduled all-staff meetings, so we could kind of use staff time wisely that way.
Thank you.
Thanks, Michelle.
You're welcome.
Nicole, I think it's on to you.
All right. So I did put this in a written report that you guys can reflect on further. So I've met with a number of staff and staff from a wide variety of sections and roles, so leadership, line staff, HR, and corporation counsel, as that first part of phase one of getting a better understanding of what the culture and the patterns and the relationship ins and outs are at this point, and then moving into phase phase two, starting for me as well, supporting what Stacy did with her training last week. I have my first of 2 trainings this Thursday. Now, my first 2 trainings are the same, and so hopefully Human Services Board, you also got that to sign up. So they're the exact same training, either this Thursday, October 14th, or Thursday, December 9th. So hopefully you guys can sign up for those. And then in my report, I also gave you a summary of the climate culture, the confidential Survey Monkey, and hopefully you guys were able to partake in that as well. There's certainly some positive things to start. I think one of the most positive themes that came out in both the survey and in my one-on-one talks with folks is how many people really are committed to making a change, either because they're part of what needs to be different, or just some insight to the fact that there might be something that they learn and do something different to make things better. So I think that's a really great place to start. There's some positives in the survey that came out. A lot of people feel that they have other people that support them in the agency, and they get along with people. They really do like their job. They have a lot of committed staff. Hopefully through this work and this project, we will help you retain staff, which is really, really important, both for morale and relationship building, for continuation of services, but it's also fiscally really important. The more that you can retain staff, it costs a lot of money to add new staff and get them all trained up. So this is actually pretty cost effective as well, which is really important as we're balancing out the business side and the personal side of what we do in working in human services. And then I highlighted some areas that need some focus and improvement. Certainly having a voice and believing that my voice is heard and important. Creating an emotionally safe place to give and receive feedback is going to be really important. Some people feel pretty solid in that they do work in an emotionally safe place. However, a little over a quarter of the respondents felt like they did not work in an emotionally safe environment. So, and then the culture of respect came out even more important as an area of focus, and increasing the positivity. And hopefully, I think a lot of staff gave feedback that they were hopeful in this project that you guys are supporting with Stacy and I coming in. They're hopeful that this really will make a shift in both what's happened, but also just in the overall patterns and the way that people work together. And ultimately, when you have happier staff and staff that are more productive in their relationships and the way that they do their work, it's a better outcome for your community and the clients that you work with, which is your overall goal, as well as having a really great place for staff to work. So again, I hope that you guys have signed up for either one of the 2 trainings in October or December, and then a third separate and brand new training will be in February. Any questions for me?
Does not look like it.
Questions?
Were those 2 dates also 9 o'clock to noon?
No, those are full days. Good question, Michelle. Thank you. Those are 8:30 to 3:30. Thank you for asking.
And
And,
pick-
I
you
believe-
can pick one or the other date. You don't have to be at both of those dates.
Thank you.
Yeah.
And Stacy's trainings are virtual and my trainings are in person in the Trempealeau room.
Okay. Any other questions? If not, thank you.
All right, thank you.
Thank you very much. Thank you for your ongoing work. We sincerely appreciate it. I think it is, I mean, we're hearing conversations, and I do think the hope for a better future is becoming more palpable every day. So it's making a difference, so thank you.
Bye, all.
Okay.
I just want to comment, I didn't do the survey because I felt I don't know your working routine, and so I didn't do the survey.
And that's okay. You didn't do the survey. I think the consultants kind of wanted, if you had something to share, was your opportunity. If you didn't, that was fine too. They kind of wanted you to know what's being asked. And so, again, you got some of the results back here today of what what staff said. So I think that's good information.
And I kind of looked through her questions, and I felt they had to be people that were definitely working with you and the group to respond to it, and I didn't want to do misinformation. I thought I'd probably learn something on Thursday.
Okay, thanks.
Okay. Move on to mental health services report.
So there's several things going on. Erica can give you kind of a 30,000-foot level summary of it. We're not going to get into the detail of it today because, quite frankly,
I've been dealing with crisis.
yeah, we've been dealing with other stuff. So we didn't get that full detailed report done, and quite frankly, things are still evolving, so I think it'll make sense to bring back to you in December, but Erica can give you a quick or summary of what it's going to be about.
So this is, it's on, right? Okay. So really, I think one of the things we really wanted to kind of dive into is some of the changes we're seeing. And so I'll provide more detail around that in December in regards to mental health and kind of where money is being spent. Just because we're seeing some trends and changes in those trends, not necessarily bad things, just differences in places people go and length of stays and things like that. A couple things, or one thing I for sure want to highlight. Number one, our crisis calls continue to significantly increase. We had a really high number last year, and it looks like we're going to surpass that this year. We can continue to see people that have not accessed the mental health system in the past. And a lot of these people maybe even coming from older age groups than we're used to experiencing. So that's just been a little bit of a change for us. We could analyze the whys of that all day long. I guess the good news is people are getting services. That it's just different for us. We're not seeing a lot of, we're still seeing the people that we've seen through time, but we're also getting a lot of new clients in, and sometimes again from that older age group. And I think some of the effects of COVID and the isolation and loneliness has just increased. So with that comes that extra layer of anxiety and depression. The other thing that's we continue to see, of course, is our Winnebago costs going up. Winnebago costs about $1,500 a night, and of course that's a lot of money. So there's been some questions about the reasons why that. We don't actually choose when clients go to Winnebago. That is a process determined through the emergency detention system. So when an individual is emergency detained in the community, we contract with Northwest Connections for those crisis calls, and they call every available facility. Winnebago is always the facility of last resort, but they're also the only facility in the state of Wisconsin that is required to take individuals on an emergency detention. So we've talked about this issue, and again, we're going to talk about it again today because I'm going to keep reminding you to contact your legislators and advocate for more hospital beds on this side of the state, but also just a good reminder that this continues to happen, and we'll talk about it again in December. But we don't have enough hospital beds. So when people are in a mental health crisis, we've had a hospital bed shortage on the western side of the state for quite a few years now. And it got worse when Mayo and La Crosse closed their acute psychiatric unit. And then, of course, COVID came along and created a lot of bed issues in hospitals in general because of wanting people in single rooms and not sharing for obvious reasons with COVID. And it just decreased the number of beds even further. And of course, we've also talked about that we're seeing more mental health crisis since COVID started. So we have a need for more beds. We have less beds available. And then our last option, of course, is Winnebago, which is the most costly. So that's some of the things that are going on that are contributing to some budgetary concerns, of course. And then also a unique thing over the last year is we've had 2 or 3 extremely costly Winnebago stays. Usually when an individual goes to Winnebago, they're there for a very short amount of time because they're an acute psychiatric facility. So they move along from there to either back home or to a different placement or whatever. But we've had some longer stays, and that's been largely out of the control of the county. Who these individuals are individuals that have been served by long-term care agencies. And so they are individuals that qualify for long-term care, meaning they have, some type of intellectual or, cognitive disability, physical disability, or aging, thank you. And actually the ones that we're I guess I'm going to say managed care is struggling a little bit with finding placement for is individuals that need some type of residential facility, but also have some challenging behaviors and some underlying mental illness. So we've had 2 situations in which managed care organizations were unable to find placement for these individuals in residential settings. They continued to crisis until they ended up in Winnebago. And then what's happening in his managed care is leaving them there until they can find an appropriate facility. This is causing lots of issues and headaches because, number one, we're legally obligated to get these individuals into the most restrictive setting. The least restrictive settings. So we have the courts over our heads telling us that you need to get this individual out, and we know. However, I was dealing with this all day today, in which we have a place for an individual to go. The county is not supposed to be finding the placement at that point, but Deb has done some work in talking with other counties across the state through WTCO, and we're not the only county experiencing this because managed care is saying they're going to find the placement. However, every placement that we come up with is not appropriate in their eyes. So they're fighting us. We have an individual, for example, that's been at Winnebago for over 30 days. So you can do the math on $1,500 a night. The county stepped up. We found a placement. We feel it's appropriate, and managed care does not agree with us. So now there's disagreement about whether or not the individual should leave. We're pushing for them to leave. He has rights. He should not be there and held there against his rights. The doctors there are stating he should have been gone on day 2. And the court is also saying he needs to be out. So, but that's just some of the dynamics of what is happening, I guess, out there in the real world.
Yeah, so we're going to continue to work on this with this issue with the WTCO group. That's for discussion at our next meeting. So I actually won't be at that. Edrc will be at that in my place, listening in on that call. But there's every county is starting. There was a time when family care was first created, it was much more stressful between counties and family care, and now it seems to, for a while it really calmed down, but recently it's really been ramping back up again. So with every county, so we aren't unique or special. Part of the issue is all the family care agencies, there used to be a dozen or more, and I think they've consolidated down to about 5. So they operate as these giant conglomerates and make it sometimes harder to, I think, have some of these individual issues being addressed properly. So we'll continue to work on it. Quite frankly, just to kind of summarize what Erica said, we have 2 individuals that we've been dealing with this year, and between the 2 of them at Winnebago, we will be putting about $100,000 of human services levy in for these individuals, and that's assuming the current individuals moved in the next week. So that's, what were you saying?
Nothing. I said,
Oh, I heard the background, sorry.
Sorry about that.
Somebody having a baby, yeah. I think we got someone else's background stuff, but, so yeah, I don't know if people have questions about that, but I just, that's a lot of what we got going on. I probably nothing super surprising to anybody. We're hopping, so,
More to come.
yes.
With that, we'll move on to number 7, and that's the county board rules.
Yes.
Women's-
So there's a handout for this. It starts out with an email to department heads from Rick Niemeyer, basically sending out the county board rules and kind of asking that we look at our committees to see once, is this really a reflection of what our committees do? Is this really up to date? So I wanted to run this past you before I make some changes. And if you want to kind of look at that quickly, and if you have any, after you take this and look at it and you have some thoughts after the meeting, feel free to shoot me an email, because I need to get this to Rick this week, because it's going to be moving forward with exec finance next month, looking towards some approval. As far as the first page, I don't have any recommendations. It's on the second page that we have more recommendations. Between item 10 on the second page, where it says be responsible for administering Wisconsin statutes, and it lists some of them, chapter 51 is not in there, so we're going to need to add that. Also, on number 17, it mentions chapter 71, and also item 15 mentions some statutes. So we want to reconfigure those into one statement, so it's all in one place, so it isn't all over the place. Chapter 51 is the mental health statute about emergency detentions and what we can do in terms of serving individuals with mental health needs. And as you heard in Erica's report, that's a really important statute. We reply to that, or refer to that one quite frequently. The other item that I would recommend change is item number 12, elect a member to the Board of Area Agency on Aging and Planning. Since this has been written, we've merged the ADRC and the aging, so we'd like number 12, we'll change the language to match the resolution, the language in the resolution that was created to merge aging and ADRC that happened in 2014. So those are the only changes that I would recommend, unless there's anything any of you would like. And again, if you don't have it now, you certainly can bring it at another, get it to me later this month.
You mentioned 17. The chapter, what chapter wasn't in there? 71, you said?
No, 51.
Yeah,
So
okay, so-
51 is in 17, but then 10 references chapter 46 and chapter 85.
But that hasn't got 51 in it.
Right, and then number 15 talks about other chapters of 46. So it seems to make sense to put them all in one statement together that makes sense versus chopping it up. It's all the right chapters, they just seem kind of disorganized the way it's listed. And I think it's listed this way because things have evolved over time, and now it's just time to kind of put them together in a comprehensive fashion.
Okay, so you want, if we see anything different, or
Let me know.
agree with what you stated? or-
Yeah, I just, again, this document, there's a number of other changes I didn't provide you, I only provided you the portion about the Human Services Board.
That's all we're concerned about.
That's all we're concerned about. The rest of the document will be going to exec finance for final approval. They've been looking at some drafts of it. Exec finance will be giving final approval in November. So I think at the November county board meeting, we'll be looking at the final draft of the county board rules. So I just wanted to get this is your chance to provide input. Again, if there's something in there that seems weird or you don't understand it, or you would like it changed, give me a holler and I'll send that up to Rick.
Do you have anything else on 7?
No, I don't.
Okay, vacation carry forward request.
Sure. I would like to do one brief introduction for those of you in the room. Victoria Pearson is at the end of the table. She is our new fiscal manager. She started at 8 o'clock this morning, so she's very seasoned and experienced by 4 o'clock. Just kidding. So she's come in, she's spent the day with a lot of the unit supervisors. She'll be spending some more time with her staff later on this week. But she comes to us actually having worked for counties in Oregon.
In Oregon, yes.
So she comes to us with some strong fiscal background and a background in working for county, so we're delighted to have her with us. I just wanted to do a brief introduction. I'm sorry I didn't do that sooner.
Welcome.
Thank you. Thank you very much. It's nice to be
Welcome.
here.
So the vacation carry forward request is actually from Victoria's unit. So our billing specialist left us in the end of July, I believe it was, and early August, our fiscal manager left us. And that is a unit of 4 people, so that left Sam and Mary Anderson, the 2 staff. And so they've been covering since the middle of August. And again, they do reception and phone duties, so we have to have someone always here to do that. And so between the 2 of them, Mary's been here quite a while, so Mary's accumulated quite a bit of leave time. And what I'd like to do is put in a request to carry forward up to 4 vacation days or 32 hours for Mary Anderson, because she didn't use a lot of time in August, September, October, and now probably won't have a billing specialist till November. So both Sam and Mary have been great team players to make sure we have the coverage. They work really hard together. They make sure they keep me in the loop, making sure we have coverage. So I sincerely appreciate the efforts, and I don't want to see anybody lose any vacation because they chose to be here and provide coverage instead of using vacation time. So my request is to, and again, I'm not a big fan of vacation carry forward. Part of the problem is that at the end of 2020, the county board they chose to waive the limit on how much vacation you can carry forward into 2021 because of COVID. So some staff carried over a larger amount, and so that kind of contributed to this as well. So Mary's done everything right. She's done everything she's supposed to do, and I hate to see her lose any benefit. And so we've kind of gone through it. She's got about 5 days she needs to use this year, but I think she has plans to use those, and with additional coverage, she'll use those probably closer to the holidays.
We don't need to do anything there.
I need a motion so I can take it to personnel bargaining.
Has left the meeting.
We'd need a motion to approve that carry, or for you to bring it to.
Yep, make a request to personnel bargaining to carry forward 32 hours of vacation leave for Mary Anderson.
I make a motion that we carry forward 32 hours for Mary Ann.
Motion by Dora, second to the motion. Diane? Second set, okay. Everybody understand the motion? I would look for, all those in favor signify by saying aye.
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 Okay. Okay, those
Kurt, you wanna
opposed,
hand
same
these out?
sign.
You want to hand these out for
Okay,
me?
carried.
I've got a boot on my foot. I hurt my foot, so I'm not moving around as well. Oh, yep, we're on number 9.
Thank you. Well, my foot isn't hurt, so I can go.
Oh, Eric, I've got some for, well, Sam will need one, and then it looks like a couple of you
Another
have to
tree.
share them.
I said another tree.
Another tree.
Oh, I didn't take one myself.
Oh, that's why we have an
You
extra.
got an extra, thank you.
Yeah. So, again, I emailed those out, so I'm hoping that Karen and Michelle can find these documents. So last month, we talked about this briefly. We talked about the Justice Unit Supervisor has submitted their resignation and was done. And the issue was that the ADRC Supervisor, the Children and Family Supervisor, the Behavioral Health Services Supervisor all supervised 10 or 11 staff, whereas the Justice Services Supervisor supervised 3 staff. It made sense once upon a time, and actually it wasn't quite that different once upon a time, but over time it just kind of got to be very disparate between the positions. So what we'd like to do, and we talked with you last month, was about an idea about how do we reconfigure our units a little bit to even things up so that, because the issue isn't just about supervisors having too many staff to supervise. The other issue is staff don't have enough access to their supervisor when you have that many people needing to share that same supervisor. So what we've done is the sheet that's attached that says proposed, and I'll walk through this one. So the difference, if you maybe want, I stapled them, but if you want to tear them apart or however you want to look at them, in the ADRC, we would propose moving the elder abuse and guardianship social worker to the behavioral health supervisor unit. And then we would propose moving the administrative specialist to the fiscal support unit. So that we would reduce 2 staff and we'd have 8 staff. There would be some additional part-time staff as well, but that provides a little less span of control for that supervisor. In behavioral health, we really took out what we added, the recovery court supervisor, and this behavioral health unit will really just focus mainly on adults. We need a nicer name for it, so I didn't change the name, but it needs a better name. But the new behavioral health unit would be just for adults, so we would keep the behavioral health case manager, the elder abuse and guardianship social worker would move from the ADRC here. One of the CCS social workers would stay here. The CSP program, the social worker, the nurse, and the technician for the CSP program would remain in this unit. As well, and we'd also move the recovery court case manager from the justice unit over here because they work with adults as well. And then we added the youth justice CCS social worker grant because it's a grant, just like the recovery court is a grant. So we kind of would like this unit to kind of coordinate the grant, those special grants that we have. So that again brings it down to, I think it's 8 or 9. 1, 2, 3, 4, 5, 6, 7, 8. So again, that's a good numbers as 8. And then what we did is we took the children's teams and kind of, we struggled a little bit, and again, the leadership team provided some input on this as well. We thought about, because we do the child welfare side of things, and then we also do the child disability side of things. And so I was trying to find a way to split those up, but however you split them up, one supervisor ended up with a lot of staff, and the other supervisor ended up with about 6 staff. And so what we decided is, or at least we're proposing for you, is we would have 2 children's teams that look a lot alike. And so what child welfare does, right now we have 4 child welfare, child protection services, CPS, we have 4 investigators. We'd put 2 on each team. And in children and child protection, again, we have 5 ongoing staff. So we'd put 3 on one team and 2 on the other team. And we have 2 program aides in child protection. We'd put 1 on one team and 1 on the other team. And then what we'd add to that would be some of the child disability staff that used to be in the behavioral health unit. And so we're proposing moving 2 CLTS social workers and the birth to 3 coordinator to one of the teams. And the other team would focus a little bit more on older kids. And so it would include juvenile justice, the contracts school social worker position that we have that we share with GET schools, and then the 2 CCS social workers. And then economic support would remain unchanged, and the only change in the fiscal unit would be then to add the ADRC administrative person would be supervised by the fiscal manager, which while they're across the street will be a little extra work, but of course the proposal is they'll be moving in our building in the next year to year and a half. So that seems to make sense. And then we can do some, if they're out, if that person's out from the ADRC, then the other administrative staff can go over there and cover, or if we're short administrative staff in human services, they can help. So we can kind of have some supporting each other and also some backups for training on how to do different things. So that I think will be make that whole administrative fiscal unit a lot stronger. So that's our proposal. It's a little, taking the 2 children's unit, taking the child protection and putting it into 2 units has caused some staff to kind of go, well, that seems a little scary. But then when you add on the child disability services, because what and Melissa and Erica can talk to it quite a bit, we're seeing more and more of our cases in child welfare needing services for kids with disabilities, whether it's for their mental health through CCS or other types of disabilities with CLTS. In addition, in child welfare, certain cases, but CAPTA is can't remember what those letters stand for, but certain families have to be referred to the birth to 3 program in a child welfare investigation if a child is age birth to 3. So it seems to make sense to put the birth to 3 program in with them as well. So that's kind of how we came up with this. It's kind of taking what we do and kind of folding it inside out a little bit, but it seems to make more sense in terms of how we can serve families, and it really supports that whole no wrong door model. So instead of saying, well, it's child protection, so it's over here, or it's child disability, it's over here, this unit serves children. Now, there's a lot of details in here that staff have asked, some of the staff have already been asking great questions about, particularly with the two children's teams. How do we determine who gets which referral? What if one team is on call that night and they have to serve a case, but that case is actually served by the Birth to 3 program in the other unit? How do we sort those pieces out? And so you'll notice in the little gray box where it says about the deputy director, the deputy director would coordinate with these two children's supervisors, children's team supervisors, and help them sort those things out. And so what we'd like to do is get some general approval from you today, because what this will do is it will help us then define what that new supervisor will do, and we can update that job description and get it posted. Again, a lot of these details about how some of these things work will really depend on bringing that person in and having them work with the other children's supervisor and with the deputy director and figuring out some of these pieces. I gave you a lot of information. Sorry if it was confusing. I'm hoping these little graphs made sense for you. Do you have questions?
Questions?
And I don't know, Erica or Melissa, if you have anything you want to add from the leadership team that we discussed last week. You don't have to, if you have something you want to add.
Is your census going up with the child to 3, from 1 to 3?
The birth to 3 is remaining pretty even. Our number of cases we served in child welfare in 2016, 2017, 2018, is higher than what our current number is. You actually brought up a great point, Dorjean, because what this allows us to do with this new model is if we have somebody called a child welfare ongoing social worker, but we don't have as many cases, they can also assist if we are having too many cases for kids with disabilities. So instead of saying, well, I can only do this piece of it, it helps provide some of that flexibility that we need so we can address the needs of the people we serve. I can guarantee you at some point the number of kids in child welfare will go back up again. It just does. That's how things go. Right now it's down a little bit. And so how could we use those staff in a way to do a better job of serving the families we have, I think is a great point.
I don't think this was the intention going into this. The intention was looking at the, unevenness, but this plan really will help us with this whole no wrong door philosophy as we kind of meet people where they're at and we look at our toolkits. So as a child comes up into us, it's hard in human services, and most counties are like this, I believe. I guess I haven't worked in most counties, but the systems are set up in a way that it's this is children and families, this is behavioral health, this is something else. And this really just blends all of those things so that we're all using the same toolbox. And I think the benefit is really going to be to our clients and our families. And I also think staff will find a benefit in this as they're going to feel more supported in their teams and that they have more resources to help people. So I'm really excited about it and think it's a good idea. I think, change is more uncomfortable for some people, but fundamentally what people do for their job isn't going to change. It's just how we kind of frame it up, I guess. And I think really a lot of it's about just breaking down walls and creating a pool of staff that really have different specialty areas, but we use all of those specialty areas to help kids and families.
But you are able to service all these children?
We are. We don't have a choice. We have to.
I'm concerned,
I think we're properly staffed right now. I do think we're not too far from a place of having to talk about, do we add more staff? In the, in child welfare, we just get so much money. If we add staff, it's levy funded. But if we add staff in the CLTS program or the CCS program, those services for kids with disabilities, we get money. They bill and so they basically pay for themselves. So those are free in terms of county levy types of positions that we can add. So I believe that in the 2023 budget, you may see us coming in and asking for an additional position, maybe more, because the growth in those programs continues to go up. We thought it might go up and it kind of flatten out, but it just keeps going up. And as Erica talked earlier, the need for mental health services is going through the roof right now.
So this will help us though, because some people, like, things ebb and flow, like Deb said, and so the needs in maybe the children and families unit right now are a little lower. Will that stay that way? Probably not. It's just, how the pendulum swings, or in the lucky area you're in, but it allows, there might be more capacity in that area right now for workers to do different things. So it allows us to use our capacity better in a smaller county. And there could be times where maybe the behavioral health needs ebb a little bit, but things are blowing up in children and families, and that's where these workers are all just working together, and we can manage caseload sizes much better. And again, I think staff will feel more supported in that they have an entire team of people with lots of different specialty areas working with them to identify resources. It just makes things more efficient for staff and for the people we serve.
And so you're able to reach all these little, I'm worried about those babies. But they all, how do you, and that's a question, how do you know what is happening after you have been someplace? Do you follow up?
We have a lot of requirements, not just on follow-up, but if you get a call, how soon you have to follow up, how soon you have to visit, what kind of documentation you have to keep, and then the supervisor, of course, works with the staff to make sure that those follow-up pieces happen. So that does happen, and it's by the law. And then we have auditors come in and look at that to make sure we've done those things.
Lots of rules.
Lots of rules.
Because they can't use a phone, they can't call for help.
No.
No, and so a lot of times referrals for those really young families come from hospitals when people are concerned, or perhaps after mom's had baby, mom goes in for doctor's appointment for those well baby checkups, and it's like, ooh, this family needs some support. Could be grandma calling up or a neighbor. It could be the school because there's an older sibling in the school. So there's a pretty good support network in our community. So those calls typically happen. There's still, we keep trying to keep having anybody from falling through the cracks, but
It's a big concern of mine.
Thank you. That's a good thing to keep on our radar. Thank you.
And you want to get an approval on reconfiguration?
I would like it based on the org chart. Again, I think there are, I'd say 1 million details, and probably will be close to that many. There's a lot of details that we haven't figured out yet because this is just a high level. But what we need your support on is, or what we're asking for your support on, is this model so that we can write a job description and get that supervisor position posted. That's, by the time we get that posted and the new person in, that's going to be 2 months down the road. And so we're going to continue to work with staff to kind of sort out some of these pieces. And there's some pieces of this idea that aren't going to be nearly as great as they are in my imagination. And we're going to have to kind of go back and figure out how did we used to do this, and we might have to change, we will have to change some of these things. Any great, bold idea, you have to kind of tweak pieces of it. And so we know that that's going to happen. But this will be enough to help us write that job description and get that supervisor position posted, which is the first big step we need to go forward.
Okay. I guess Deb has provided us with all the information that we...
And Karen, if you don't mind, I know you had some thoughts on this at the last meeting, so I was just wondering if you had any questions or anything you wanted to add?
No, it makes a lot of sense to me. Yeah, it makes sense to me. I didn't expect the family and children's to get split, but it really does, that works. Numbers wise. I think that was a good solution. I'm a little confused about this. The one unit supervisor also serves 30% as deputy director and coordinates the 2 units. Yep. Can you explain that position to me one more time?
Yep. Actually, people that have looked at this plan said, sooner or later, you're going to need a full-time deputy director. And I think that if that's what your thought's going to, I think that's a fair thought. So when we started this, again, what was approved for the 2021 budget and what we have in the 2022 budget right now is about 30% of one of the unit supervisors would serve as deputy director. And then the other piece I should add is that all of these social work teams would have lead workers in them. So that again, right now it's a behavioral health supervisor who serves as the deputy director. So in the current configuration, Erica has 3 lead workers who can really take on pieces of things and really kind of monitor and follow those, and that allows her some capacity to be able to serve in the deputy director role. But it isn't perfect. It doesn't feel perfect yet. It was what fit in our budget, but I think it's something, as we look at this proposal and as even we look at the strategic plan we're going to be working on for 2022 through 2024 or 5, I lose track which year ends. I think we need to figure out how much deputy director we really need. Is that your question?
Yeah, because I was doing I don't know how one person can do all that.
Yeah, I think, it's going to be managing the referrals between the 2 teams. Again, these are unit supervisors, so we're expecting a lot out of these individuals. It's just that when there are times where there's a really what's going to happen is you're going to end up with a really complicated call some weekend, and one of the INA workers is going to go out and do a bunch of work over the weekend, and then that family's being served by the other unit. And so what do we do with that? How do we handle that? How do we sort that out? That's the kind of coordination that we'd be looking for. It's mostly in terms of referrals. The 2 units should, in essence, operate pretty much identically. Go ahead.
I think that's part of it is just, so it looks like a lot on paper. I can tell you from my perspective, this is actually going to be less, I don't want to say less work because that sounds bad, but I mean, right now my load is really heavy with all the certified programs and, probably next to impossible, but this restructure would lighten I would have more assistance from supervisors as far as overseeing certified programs. And then I think our thought with that was really just the facilitation of, in some of this no wrong door philosophy, understanding this is going to take some time to really get people flowing well and understanding how things should flow through the system. So it's not so much like a paperworky, I consider like the certification piece, the really heavy load. It's going to be kind of facilitating, having someone help make those decisions, referral decisions about where things should go and how and why. I think in efforts to keep it smooth and not create kind of another division, which are common in human services of I'm this team, I'm that team, I'm that team. Well, no, we're all like one big team with many little groups in there, if that makes sense. I'm probably not describing it very well.
The other thing is, Karen, is the current supervisors, for example, in aging or ADRC, this will relieve that supervisor from having to be knowledgeable about how the adult protection and the adult guardianship programs operate. So that takes that whole program off of their shoulders. In behavioral health, it takes away all the children's services, which is a lot of the services that we're doing right now. So that really provides some relief to that supervisor. And in child welfare, it really provides that supervisor with some support, because right now we have one supervisor who's in charge of all the child protection in the county. And sometimes these cases are icky and messy, and having a counterpart that will take half the cases and also kind of help be a backup person that you can go to when you're having to do a screening decision on a really messy situation, I think is going to really support. So I think each of these supervisors are going to feel a little relief, which also allows staff a little more access to their supervisor, which is something staff need.
Yeah, I think it really looks like a good plan.
Okay. With that, I would look for an approval of that plan.
I'll move to approve it.
Okay, move to approve by Karen. Second by Dora. Okay.
I forget to put
Everybody understand the motion and second here? I'd look, okay, all those in favor signify by saying aye.
Aye.
Opposed? Okay.
Thank you.
Carrie.
Thank you. This is exciting. Again, some pieces of my grand idea will need to be tweaked, but I think it's a great place to start. So, our next agenda item we have is the non-lapsing account. If this looks familiar, you actually voted on this last month, but when I went and talked to Paul, he said we have to have a resolution. So this is technically the resolution that you already approved last month. And it's basically stating that the senior services are within the ADRC. And in senior services, we have the congregate and home delivered meal programs, caregiver programs, senior transportation programs, health prevention programs, and elder benefit specialist programs. And that this year, the Roman Shabilla Estate made a donation to our county of $10,000 for home delivered meals and $10,000 for senior services. Because of COVID, we don't need those funds this year. We don't plan to use those funds this year. And so we want to set those funds in a non-lapsing account. The non-lapsing account is a way that we can set those accounts in there and that it doesn't roll into the general fund at the close of the year. And so we want to set them into a non-lapsing account for future years for when we need them, because they'll be, again, state and federal funds continue to go down, and so we will need that in the future. So this is just basically creating that non-lapsing account and then allowing us to put these funds in there. And you discussed this last month, so there's nothing new or different, other than it's a resolution time, this time.
We did pass it last month, but you want to pass it as a resolution?
Yes.
Okay, I would look for a motion to approve this budget adjustment on the resolution. Diane?
I'll
Laura
second that.
seconds, okay. I would look for a motion in, all right, that's motion. All those in favor signify by saying aye.
Aye.
Okay, those- okay. I guess we got them all carried.
So this next agenda item is a little bit different than what is posted, or is a little bit different. So we put this agenda together last Monday, and then the exec finance met on last Monday. And exec finance, as you recall, with the Trempealeau County Healthcare Center bill, it was discussed at our last meeting, and it was moved that the exec finance, if they want the bill paid, they should figure out how to pay for it. And so they met again last Monday, and we'll be forwarding a proposal to take funds out of the general fund. They'll be forwarding that proposal to the county board next Monday. So that's all done. You don't have a resolution you have to approve. Initially, when I contacted Mr. Niemeyer and Mr. Severson, they said, we'll do a resolution, ask for the general fund, and that's what I was going to bring to you, but then the exec finance committee met and took their action, so that's different. The other piece I do want to update you on is the attorney's fees. I do want to let you know that we have received bills on this for July and August. We have not received the September bill yet. The bills for July and August are $11,063, and we still have one more month to pay. So that will be an amount that will come, we'll have to take that out of any unspent funds we have from this year, or we'll have to take it out of our risk reserve account. I know when that was talked about with this group, I'm not sure what anybody thought the attorney's fees were. This is certainly higher than what I was thinking they were, but nobody ever said an amount, and so I just wanted to update you on what that amount is. So we'll probably be looking at around $16,000 for attorney's fees for an $18,000 bill. And this is the attorney that this body asked Mr. Niemeyer to get services from. So nothing, no action to be taken, but I just wanted to provide you an update on that. Does anybody have any questions or anything?
Okay. Any questions? If not, we'll move on to
It's gotta be
number
paid.
12 here, discuss human services priorities for county COVID funding.
Sure. So the county has received around $5.7 million of American Rescue Plan Act funds there's a variety of things how you can draw the money down and things you can do with the money. The Exec Finance Committee has asked Board Member George Brandt to work with each of the committees to find out what their priorities are in terms of using those funds. And so the leadership team and I have come together, and actually Melissa Youngbauer, our ADRC services supervisor, kind of took our half-baked idea that we had and ran with it. I do want to share with you, I didn't make a copy for you, Kurt, because you get the Wisconsin County magazine. So you already have this article. But this is for Dora and for Diane.
Okay.
The magazine that just came out this past week, this is the cover of it. And the cover of it is mental health and aging. And they spend a lot of time in here talking about loneliness and the impact of COVID on individuals in terms of isolation and loneliness. And that really fits in a lot with what Melissa's going to share with you in terms of what we as a leadership team have talked about, creating some ways that we can help this community. And you know, we talked, we see the numbers that Erica talked about of people coming in with mental health and anxiety issues. We know people in our own lives that are dealing with greater anxiety or greater loneliness because of either working from home and not having any socialization, you know, being elderly and being at home and not seeing anybody. We're hearing about more and more kids in schools. The anxiety that they have about COVID is highly unusual. So this whole thing has affected people's mental health in a very unusual way that none of us could have ever predicted. And so we really spent some time talking about what do we do to really bring community back together, because that's what people are missing. We're missing each other. We're missing other people. We're missing that social contact. And so, Melissa, I'm going to kind of turn over to you. Again, this is a high-level idea, but if you like the idea, we will share it with George Brandt, so he can take that back to the Exec Finance Committee, and we can talk about where this goes from there.
I do want to just start out by saying this past summer we did do community engagement, primarily through surveys. And it is interesting because the response that we got from those surveys regarding what the needs are for seniors, what the number one response was that they are concerned with social isolation and loneliness. So that this article, Deb, is just perfect, because this is exactly what our county said. People are lonely. People are not feeling like they're part of anything. And I do feel, so that is what our seniors told us, but I do feel that that is not just seniors. I think that is just all generations right now are just feeling this sadness and loneliness and just lacking being part of something. So I guess when Deb had asked us to think about just priorities and how could we possibly address that need for not only seniors, which is kind of what I focus on for the most part, but also wanting to look at communities in general, I started really thinking about what can we do to just enhance and support our community, all ages. And so what I really started thinking about was just kind of this broad-based strategy that would be, for lack of, this is just my words, what I've thought of, is either community centers or friendship centers. And that too was a big part of the surveys that we got back. People had that, that was coming through loud and clear. People were saying, we want a senior center. But not only senior center, let's expand it and maybe just a community center. And when we think about a community center, we do have some communities in our county that actually have a community center. So when you think about Wanik Center, I think of that as a community center. Places like Whitehall may not have an identified community center, but I think we can look to see in all of our communities what could be used, as a center, or just a strategy. So in Whitehall, maybe it's the library, maybe it's the schools, but the other piece of this is bringing all of the entities together, such as law enforcement, again, schools, libraries, public health, extension, kind of getting everybody together to meet the needs of the community. So some of the things that I just had jotted down that
And I think the other piece that goes with this is multi-generational. Well, again, Melissa said she focuses on seniors in the work that she does. She's also worked in just about every other unit we have here at some point in her career. And so she's got a lot of experience with what kids and families need too. So this is really connecting the whole community, which is, I think, one of the cool pieces of it. I just want to jump in.
Sure, and absolutely, and I think going back at different times, people have had ideas about intergenerational activities as well. Yeah, so, and we are doing, I feel, some pieces at the Wanik Center right now. That's just an example. There are other communities as well that are doing some pieces of this, but looking at it as kind of a strategy. I do feel like the things right now that are happening at Wanik would include the senior dining. The numbers have been incredible, people attending that senior dining, and I think that does speak to people wanting to get together.
We've had close to 70 people. I mean, we've never, ever had 70 people at a dining site on a given day. That just tells you, and quite frankly, our other dining sites have hot numbers way higher than what they've ever been in the past. I think it's because seniors are looking for something to do, someplace to go. There aren't a lot of options. And so what we're doing, even with senior dining right now, is one of the things that's helping support the community.
One of the things that is happening as well at the Wanik senior dining site is there are high school volunteers that are supporting that program, which I think is a really, really neat thing. But just some of the other things that I've jotted down that we would, I feel, want to focus on in all of our communities would be ideas for maintaining healthier lifestyles. So that would be, fitness. Also just education in general. Just some of the programs that we've done recently here in the last month that the Adrc has sponsored have been youth in transition programming. So again, those kids that are transitioning from youth services that have disabilities to adult services. And we've had people that have attended, not high numbers, but we've had people that attended, and then also the identity theft training. We could be doing some of these support groups that we're hoping to launch here in the next year, which would include the memory cafes and actual caregiving support groups, but then expanding that to parenting support groups, parenting education. So also some of the things that I've talked or jotted down would be just information, I don't know exactly what that would look like, but information about the resources that would be available and that are available in our community. I don't know if people always do know about those. And possibly some short-term counseling or life coaching, something of that sort that maybe just a very short-term intervention might be what is needed in some situations. Some situations, maybe people then do need to be referred out for longer services. And then also just resource utilization. Some of the things just speaking about, like even the ADRC, again, letting all of our communities know about things like the farmers market vouchers, things like that. So those are just some of my ideas.
I mean, there's so many things. I mean, having a workshop periodically on guardianships for adults, when you think about parents that are aging and what is a guardianship versus what's the word? POA.
Well, power of attorney for
sorry.
healthcare or.
Yeah, I mean, I think.
I'm sorry. Yeah.
I think that people don't realize those. I mean, just having those kind of education on the that we've done periodically regarding financial exploitation for seniors, some of those things to look out for. Mm-hmm. And then other things in the community in terms of just having grandparents helping younger kids with their reading skills after work, things like that. There's just, what we could do, the outreach we could do is just kind of almost endless. And but it's building connections and strength in our community, which is what we really need.
And that's, some of the people there would meet the needs of other people. So you look at the elderly population and the loneliness and isolation, and we look at some of our youngest kids who need role models in their lives. And it's like, how do you just simply connect to those people because they're mutually fulfilling the needs of the other group? essentially, and even helping parents with their stress and anxiety. Not every kid that needs assistance, it's because the parent is a bad person or a bad parent, but it's all the stresses we face in life and mental health and addiction issues, and so having a safe place for kids to land after school, get some help with some homework, having a safe place for anybody to go, whether it's a mental health crisis, there's people here that just care, and that's all I need to know, or I can go there and ask questions and maybe get pointed in the right direction. Yeah. I just thought I'd
So yeah, I think it's, it's just, my ideas are just very broad. Again, my idea has to do with just connecting people and meeting needs. And how do we do that with a broad-based strategy, and really, again, determining a strategy.
And, these might be, again, if we partner with schools or libraries or other public-type facilities that are in each community, it might not be every day, but Aliva Strum, for example, if we worked with their school, it might be Thursday night and 1 weekend a month or something. But at least it would be someplace that people know that they could go and they could connect or get whatever it is that they're, meet with other people, help some other, work with some kids, whatever it is, just a place that starts to build that community center. And then from there, we kind of figure out where does this community want to take it.
Right.
So it isn't like every community is going to have everyone all the time, but I think it's available throughout the week or throughout the month.
I think it is also just kind of breaking down some of the walls in between some communities as well. Because like you said, we can't offer a youth and transition training to every community every year. But I would like to see, it does seem like a lot of times information isn't being distributed to everybody. So we might do something in Whitehall, and people in Arcadia, we're kind of trying to do our best to let people know about it, or in Blair, but it's kind of to break down some of those barriers. We want communities to have their own identity and to determine what their needs and what their areas of focus should be, but also using our resources wisely.
Karen, you had a question?
I think it was Michelle.
Oh, Michelle, sorry.
I have a few ideas.
Love to hear them.
Well, first, if you connected with UW Extension, what, how, and where, they would give free information. Another one, what about town halls? They might be able to have, for free, have a gathering, say bingo, arts, nature, farm updates.
Bingo's a biggie.
Church places, coffee chat, maybe at restaurants. And this is interesting because how many young people know how to play cards like the grandparents do? There's a lot of games they probably don't even know about.
Oh, Michelle, you've got great ideas. I can see their ideas are just starting to tumble out. So, yeah, these are great additions. What we want to do is talk to George this month is about our general idea. Again, we haven't put pencil to paper to figure out what's the cost of this going to be. We kind of just want to start to get our placeholder in everybody that's asking for that money. And we want to, obviously, we're not going to need all of it, but we'd like some piece of it to be able to do these things.
I have noticed, just in our small communities, the men do not want to be involved. It seems like they just stay home, where women, they get out and there's all different kinds of groups that they're doing things, but the men, you don't see them. I know there's a couple places that play cards in Independence. I'm just speaking for our town. But the women, you see them in groups going places all the time. Man, I know my husband, when he was living, he'd say, you go, I want to stay home. So.
And that's okay if they're okay with it, but when it bleeds to loneliness and isolation, which we see in a lot of the people we get calls on.
In our area,
yeah. And I know of one person that he said his mate was gone and he just didn't want to live anymore, and he did take his life.
That's terrible. That's what we want to avoid. Other thoughts on this idea? Again, it's a pretty big fuzzy idea. There's a lot of murkiness around it. But I think we kind of want to start to, again, just be able to see once the people are excited about this and if this is where we want to go, and then we could take it to Mr. Brandt and the Exec Finance Committee.
And I would suggest better traveling for them. You know, I mean, if you probably go to these, several of their homes and stuff and have a bus or something that picks them up, then maybe they would go. But it's just the idea that they're not.
Well, transportation, yeah, is another issue that I think we would need to consider. Is some people can't get, so how would they have the opportunity to get there?
Yeah. Because I'm one of them, but I don't have time to.
I mean, the question is, how do we use our transportation funds most effectively in our community? And maybe this kind of is a shift for us. I mean, I think that's a great question for us to look at.
And there are a lot of places that are doing a lot via video. I have not seen some of the things that I've read about and heard about, but we have done some groups here in this county via video, and kind of with moderate success, I guess I would say. People haven't really embraced those fully, but some places there are people of all ages that are doing a lot of groups via video. So.
Is this an idea that you all concur that we should take forward to use those COVID funds? Obviously, we'd have some funds to get it started. We'd have to also talk about how do we sustain this in the future. But I think that that's part of the rolling that out.
Going to talk to George Wynn?
I don't have a date. I just wanted to get
Oh,
this.
okay. Yep.
Thank you. Thank you, Erica and Melissa, for the work that you've done on this. I know Erica, when we did our strategic plan 4 years ago, talked about these intergenerational centers. I'm like,
We just needed COVID for this to come to fruition.
yeah, I guess that's, well, there's one good thing of COVID then. But Melissa, we talked about it, and she kind of just took the idea and really started to put some additional thoughts around it. So thank you both for your work on that.
Go on to budget update?
Sure. There's only a couple quick things. A number of the counties I'm working with on our state organization are talking about opioid funds that are coming to them with the opioid settlements that's going to be coming through. I've been in communication with Mr. Niemeyer to find out how much that is for our county. He said we'll be finding out in the next week or so what that will be. I know we did not plan on using it in our 2022 budget, but these funds would be cost to the county because a lawsuit with nationwide lawsuit with the manufacturers of opioid substances to help pay for some of the costs to counties and so certainly Human Services had to pay for a lot of those costs in the past. And so this might be an opportunity for us to look at doing something unique and different with these funds too as this comes forward. So I just want to put that on your radar.
Well, and I just want to add, we're still paying for those costs because of the people struggling with addiction, and we know that isn't something that you go to treatment once and you fix. So we're still struggling with the people that were prescribed the opioids from day one and still are struggling with their addiction and treatment,
So that's just something to get on your radar that will be coming forward soon. And then we did take our budget to Exec Finance. They didn't have any questions for us. They were pretty pleased that we asked for a little less money. They were very pleased with our consideration about some of the concerns for some of our placement costs for kids and adults that we had in our narrative that we gave you in August. So they actually liked that format. They said not going line by line was much better than having to go line by line in the budget. So they really liked that conversation. So it's moving forward. We did get the numbers for the health insurance, but Paul has indicated that, Mr. Severson has indicated that the county should be able to cover most of those, that change. The only change that's kind of still out there is the compensation study. Department heads and staff have not seen it. The proposal that was voted on by Exec Finance, I believe, was around $400,000, half of which was already accounted for by each department budgeting for staff moving up a step. So half of it's already paid for, so they'd have to figure out how they're going to come up with the other half. How that affects any individual's pay has not been released and won't be released till closer to November, when the plan will be approved by the county board. And Paul's already asking, he just emailed me today because, for example, in economic support, we get 50 cents on every dollar back from federal funding. So of the money that it's going to cost our department, how much of that could we get back? So he wants that kind of information. So that will help offset some of the county levy too. That's all I have for the budget.
Okay. ADRC
Lease.
lease discussion?
Yeah. So the ADRC lease expires the end of January. It was a 5-year lease. It seems like we just talked about it, and the 5 years have gone by. The building is up for sale. The current lease requires that if the building were sold today, that whoever purchases it would have to honor the remainder of our lease. So we would be able to stay there till the end of January. I haven't gotten the impression there's any imminent sale pending. Rick Niemeyer, Corporation Counsel, reached out to the landlord to start conversations about negotiations for the lease. They have asked that the county would pay the property taxes and the insurance costs on the property as part of the rent, in addition to our current rent level. When you add those two up and you compare them to the current rent, it's about a 40% increase in rent. The other issue, of course, is that at least as of the middle of September, this may have changed, there was some back taxes as well owed on the property. So is that expected that we would cover that? And of course, the party you pay taxes to is to the county. And the county has really had a pretty strong opinion about not paying our own taxes. That's something that they've tried to avoid in other property situations. We budgeted for less than what, because we're in open session, I'm not going to say the amount, but we did budget for less than 40% increase, like substantially less than 40% increase in the facility. So there's a couple things that we could do. We could talk, you could talk with Mr. Niemeyer at your December meeting. There is no November meeting, or you could have a special November meeting to talk about what direction you want to give him in terms of negotiating. Or another option is that you could say, you know what, Human Services is not specialists in property. That is the property committee's area of specialty. And we'd like to transfer the responsibility of that facility to the property, to maintenance, and move the budget over as well. And if that's something you want to do, again, it was talked about at Exec Finance, and there were some members from Property Committee there who said, well, it won't be any easier for us. And I didn't disagree. I mean, the landlord there can be unpredictable sometimes. And so it could be a challenge for whoever gets it. But it's certainly not my area of expertise. It's very unusual. We have about 100 contracts between what we get from the state and what we have with our service providers, and it's very unusual for Mr. Niemeyer to be negotiating it. Like, we negotiate our own contracts. So that's where it kind of was like, this is just so awkward, because it's our budget, it's our responsibility, it's our building, but somebody else is negotiating it, and we're not even we're not experts in facilities. The other thing I did share with the Exec Finance Committee is, in the event that negotiations fail, what happens? Because that's going to be the question somebody's going to ask. And if need be, we would move the ADRC back into this building. We would take over the Trempealeau room, kind of set it up as a little cube farm in there. We'd have a lot of staff working remotely. It would not be ideal. The ADRC would have to be located on the first floor of our building, so that would be there along with many of their staff, although maybe not all of their staff. And again, it would not be an ideal situation, but it's better than being held hostage in a negotiation situation. So the Exec Finance Committee was pleased that we at least have a backup plan if need be. So the question today is, how do you want to proceed with this? Do you want to have a closed session with Mr. Niemeyer? In a special session, do you want to transfer this to Property Committee? what are your thoughts on where you want to go with this?
I kind of like the transfer of to the property committee. It's really weird. I can hear myself.
Yeah, the audio is very loud, so.
Turn it down.
What do you
Yeah,
think, Kurt? It's 6 of one, a half a dozen of the other, isn't it?
Well, I know one thing, it wouldn't, they sure wouldn't get the increase they're asking for. You know, if we could make a deal with them, that'd be the best. I mean, then we don't have to, this moving isn't easy. So Rick is gonna stay on it?
Rick is continuing to do the negotiating.
I know it's not out in the open, but what they're negotiating is satisfactory from your viewpoint?
No, what's being asked for is nearly a 40% increase.
No.
Oh,
You said the offer to them.
we haven't made an offer to them.
Oh, you haven't, okay.
That's
I
kind of, that's.
misunderstood you there. What?
Rick has said, where do you want to go with this? And I said, I really need to talk to the Human Services Board.
Yeah.
So that's where we're at.
I have a question. They are being paid for the use of this building, correct? You pay rent.
We pay rent to use that building across the
So
street.
why is he asking for you to pay the tax as well?
Because the lease is up, and so they can ask, I mean, again, how do we renegotiate this
Oh,
lease?
okay.
And so they're asking for the taxes and the insurance. I mean, at least, if anything, I think we would say we would increase our rent, but we're not going to be paying those items. On the other hand, they're delinquent in taxes, so it's kind of a sticky situation.
Very nice. Yeah, that kind of surprises me.
It's between a rock and a hard place, really, because to try, there is room in here, but it's like, it's not ideal, like you said.
I mean, the other
Have
option
to
is
go
I
down
could
the
go
base.
back to Mr. Niemeyer and say, this is what we can afford, and make that offer and see where that goes.
I wouldn't have a clue on what.
That makes the most sense to me.
Okay.
Yeah, I'd hate to see us have to move back. It's good we have a backup, but I'd hate to see us move back. But also, they're making kind of crazy demands. So I'd make them an offer what we can pay for rent and see where it goes. I can't imagine they want that building to sit empty.
Is that Karen?
That was Karen, yeah.
Okay.
Okay, we'll do that. If
Yep.
they're, I will, because we're not having a November meeting, I will be in contact with each of you and kind of let you know where this is setting, because, again, this is, expires the end of January, so we don't want to let this whole thing sit too long.
No,
So,
no.
thank you, that's helpful.
Do you also, this is another, do you also pay the heating and everything?
We pay for the heat and the lights, yeah. And the remodeling that was done in the building was done by the county, but it was all by a grant from the state. And so there isn't any levy funds into the remodeling. And Jeremy indicated that the way the remodeling was done, that the walls were put up so that they'd be easy to take down, and the carpeting was laid first. So if you took a wall down, the carpeting, I mean, you don't have like a break in the carpeting. So, and he also took pictures of before and after, so if the landlord wants us to return it to the condition it was when we took the facility, we can return it to that as well, if that's what they'd like.
Deb, I don't know if this should be said now, but a reminder just about the air conditioning. Is that
Please, yes, I had a
functioning?
note and I forgot to say
Okay.
it. So, well, why don't you explain it?
Sure. It was probably, I would say, maybe the beginning of September.
Late August, early
Yeah, could be even late August, is that the air conditioning stopped working. And so Jeremy had, he and the maintenance crew had thought, and I don't know anything about air conditioning or heating systems, but they had done some measures that they thought they were able to do some inexpensive fixes to it. Ultimately, it we determined, or they determined, that it needs a whole new air conditioning unit. So we probably, unfortunately, to me, because I like warm weather, but that's probably not a problem anymore. Even last week, though, it was very warm in there, and to have windows open, and there's a lot of noise, especially with the construction. So it has been a little bit of a nuisance. Some staff have been quite warm, even with fans and windows open. But that would need to be repaired or replaced. The air conditioning would need to be replaced.
Yeah, I think really the point is that we have a landlord who is not very responsive to a pretty significant need. You know, this is we set a record for the number of days over 80 this year. And so the ADRC staff suffered pretty quietly. I didn't hear a lot of complaints, but I was over there a few days and I'm like, whoa, it's warm over here. And so to the point where we actually had staff work remote some days because it was so uncomfortable. But the landlord was not responsive, dragged their feet, and here we are going 2 months into this, and there's still no repair at this time. Jeremy's worked very hard to try to coordinate this, but again, it's the landlord's building. So it's been a challenge. I'll just say that this whole thing is just a kind of an example of some of the challenges that we've had with this lease.
Okay, you're satisfied with what you got for information? Okay, we'll go to the aging plan update.
Melissa? Sure.
Just to give everybody an update, so I have been working hard on the 2022-2024 aging plan. I am going to be presenting the plan tomorrow when the Aging and Disability Resource Center, when the council meets, that's tomorrow morning. So that will be the first time that the plan will be publicly discussed. We do then have, there's a whole sequence that's required of us. And so then after the council meets tomorrow and provides feedback on the aging plan, then there will be 2 hearings, public hearings that will be held. Those are scheduled for the last week of October. So at that time, the public will have the opportunity to provide input to that plan. So the 2 places, it'll come out in the paper this week, and it has been posted already, but we will have one public hearing here at the courthouse, and then one will be held before dining at the Wanik Center, again, that last week of October. At that point, then, we will, consider any public input that we've had or any feedback. And then the final plan will be presented to this board December 13th. I believe that is the next, December 13th. So at that time, we will hopefully get your approval. We'll be asking for your approval, and then we will submit it to the state. Does anybody have any questions at all regarding any of that?
We moved a few agenda items up ahead of the full session, so that when we do the full session, will just be in.
Any questions on the aging plan update?
It's a lot of work. Melissa's been working on this since April. There's a lot of input that we're expected to get. And there's a lot of processes that the state has us follow, and so what you'll get in December will be a culmination of a lot of work, but just so you know that you'll be getting that in December. So.
Yes.
Okay. We move on to financial report.
There is not one this month. I got it half done before we came down here, and I was interrupted, so I just didn't get a chance to finish it. I can tell you that we've been hanging on close to break even, but with the bill that's going to be coming in from Winnebago for one of the cases that Erica talked about at the top of the meeting, we're just sliding into the red just slightly. So we're hoping we can kind of turn that around the rest of this year. The children's placements have been down a little bit, but there's some children with some pretty profound disabilities at some pretty expensive placements. So there's a lot of money going to not very many people. So that's what's really hurting us right now in our financial report, but you'll get one in December.
All right.
Personnel report, we had a behavioral health position that was open, and that's been filled. Unfortunately, it came from an internal candidate, so now we have a vacancy in child welfare. We also have another vacancy in child welfare. We just filled one, and now we're back down to 2 more vacancies there. The fiscal manager position is filled, so welcome, Victoria. Also today, we started our new economic support specialist position, so we have a new person, 2 new people starting today, so that's great news. Our billing specialist vacancy, we actually did interviews this past month. There was some inconsistencies on some applications. It's nobody's fault, but we had to kind of repost the whole thing, and so we're doing a redo. But the cutoff is this week, so we're hoping to do interviews late next week and get that billing specialist position filled as soon as possible. The supervisor vacancy will be filled now that we know what to put in our job description based on the reorganization we talked about today. And then later last week, we did get a resignation for our administrative position that's in the ADRC. That'll be switching over to the fiscal admin unit. So we'll, if it's not posted already, it'll be posted shortly. So at this point, we have 4 positions we filled this month, and we have 5 vacant positions, but one of them should be filled this month yet. Hopefully that revolving door is slowing down.
Okay. Then our next item is the closed session. I would look for a motion to go into closed session.
But it's such a long thing you gotta say.
Nobody wants to read it.
Georgine wants to make the motion, but it's too long to read.
If I can just read.
Someone's got to read it.
If I can
Can't
just
be
read,
me.
can I just read what's here?
Yes.
Yep.
Okay. Closed session pursuant to Wisconsin's status or state section.
Statute, yep.
Status section 19.85. I.C. considering employment, performance evaluation, or investigation of an employee over which the board exercises responsibility.
Second for that?
I'll second.
Diane, second? Yeah. Okay. Dora?
Yes.
Diane?
Yes.
Michelle?
Yep, yes.
Karen?
Yes?
And I'm yes. Okay, we are in closed session. We had
We
about a
want to
5-minute
keep.
break.
Can you hear me?
Or